Hi Mama! Welcome to this video. Today we're going to talk about the development of baby as well as pregnancy mama symptoms in week 35. So welcome to week 35 of your pregnancy. This is the very last stretch. So exciting. And we'll also talk about some tips and things to think about when it comes to hospital preparation, birth preparation, because this is the last stretch, so we have to think about that as well. So let's talk about our babies first. The babies are around 45-46 centimeters long and weigh around 2.5 kilograms. So there are 5 more weeks to go, and now every week baby will be gaining around 200 grams of body weight. And this will mostly be fat, which is then stored under their skin in layers to keep them warm when they come into this world from 36.6 degrees Celsius, nice and cozy in here, to the outside world, which is usually colder. The lungs are nearly fully developed, and also the brain is rapidly developing. So these are the last 2 organs which have very big development in these last weeks leading up to the baby coming into this world. So currently millions of new neural connections are being built all the time. So that's why it is actually super important for baby to stay in here as long as possible for this very important brain development to continue, as well as the build-up of the immune system of baby. So in these last weeks, we are passing through antibodies through the placenta to the baby. So that's why maybe you got the whooping cough vaccine, and those antibodies will be passed on to baby, or potentially another vaccine against another illness, because now is the time when baby is getting all those antibodies from mama. The baby is most probably head down. Most babies are head down in this at this point in time. So their head is here, their legs are here. Maybe therefore you'll be feeling your ribs being nudged from time to time. But the movement in the belly is not so much kind of sudden and frantic kicks, but it's more rolls and stretches that you'll be feeling. And this is completely normal and natural because baby simply doesn't have that much space anymore and the baby is growing. So at this point in time, if the baby is born in week 35, it is considered late preterm. The chances of survival are very, very high. So absolutely nothing to worry about. Maybe they'll need a little bit of help in the NICU with breathing and feeding. But otherwise, we're good and baby's good. So this is amazing news. Throughout my pregnancy, I was always a bit concerned that the baby doesn't come too early, because that comes with different complications. So from now on, there shouldn't be absolutely any complications, fingers crossed. Let's talk about mama. So the belly is probably feeling like it's lower. So maybe a few weeks ago it was a bit like higher, and now you're going to feel the shift kind of going lower as the baby descends into the pelvis. And it's called that the baby drops into the pelvis in preparation for birth. And therefore you will be feeling pelvic pressure and round ligament pain as this ligament continues to stretch with the baby moving downwards, and therefore you also feel more pressure because the baby continues to grow and gain weight. And that's why you might need to go to the toilet more often, and still shortness of breath is a normal symptom at this point in time. You might have trouble sleeping because of the big belly, big baby, the weight. You should be sleeping on your side, so turning potentially from left to right is challenging at this point in pregnancy. I hope you're sleeping with a pregnancy pillow. If not, I will link a video of what kind of pillow is the best and how to use it to get optimal sleep at night. You might be feeling Braxton Hicks, so these are practice contractions. They might start to occur more and more often or more regularly, so that's completely normal. And your energy levels might start going down as well. So you might feel more fatigued, a bit more like in the first trimester. What can we do to help mama? We have a few more weeks to go. We need to prepare ourselves for birth and for baby coming into this world, and there are different things that you can do. So number one is rest whenever possible. Get a good amount of sleep at night, 7, 8, 9 hours if possible. Have that nap during the day if you have the opportunity to do so, and otherwise still stay active. Don't become a couch potato now because you are big and heavy. Staying active and building that stamina for birth, for delivery, and therefore then for caring for your newborn after they are here in this world is very, very important. What else should you prepare? Slowly but surely, a hospital bag. And in this bag you would have some essentials for yourself as well as for your baby. Prepare a birth plan, so the ideal scenario of what you would like birth to look like, and have an option B and C in case that doesn't go according to plan, because with birth nothing is ever completely predictable at the end of the day. Know the signs of labor, so they are if your waters break, if you suddenly see blood coming out of your vagina, if you start feeling constant, regular, painful contractions, then these are all signs of early labor. Also, some doctors recommend to kind of be mindful about the amount of movement and kicks that you feel, just as another sign of making sure that baby is fine. So what can help in labor actually? These are Kegels. So Kegels is the pelvic floor training. I will link another video about that, explaining why they're beneficial and how to do them, as well as doing a Kegel training. So if you do Kegels daily, this will help with the birthing process itself, as well as with postpartum recovery. Another thing that it would be good to inform yourself about is breathing and relaxation techniques, as well as how to prepare for birth itself. So a lot of hospitals have birth workshops or information about what is possible and how your partner can support you, what options are available in the hospital, how they manage things. They will also talk about breathing techniques there. And another thing that you could do is that a lot of people go for a preparation for birth workshop, but then are unaware of what happens when baby actually joins in this world. So there are courses out there also for how to take care of newborns and what to expect. So these are also very important to inform yourself, and don't be shocked when your baby arrives in this world. And one last thing, mental preparation. So know that every birth is different, every experience of every mama is different, and you could hope to have something happen one way, it might develop in another way. So just prepare yourself mentally for being open to other options and other possibilities, as well as have your partner on board with any of these options that you prefer, so they can step in and help when possible. So this was it from me for today. I hope it was useful. Click like if yes. I hope you're feeling well in week 35. Join me for the next workout videos. We are going a bit slower. We are going to prepare our hips and stretching our pelvis, as well as practice some relaxing and breathing. So all of that that helps in birth preparation. So I hope to see you soon, and thank you for joining today. Bye.